left me connected with Rudy Giuliani, the president's attorney, and the head of the FDA. His name is Stephen Hahn.
Can you spell the last name?
Stephen Hahn.
Okay. Dice que al día siguiente el señor Mark Meadows, el Chief of Staff, lo conectó con el abogado del presidente que se llama Rudy Giuliani, el antiguo gobernador del estado de New York, y con el jefe de la FDA, Stephen Hahn.
I presented my information to them, and also information of my colleagues. There were two other doctors that were doing the same thing as I was and getting the same results.
Él presentó la información en conjunto con dos colegas de él, los cuales estaban teniendo el mismo resultado que él estaba teniendo, el mismo éxito o suceso.
Since then, many governments have called me. The Minister of Health of Israel, his name is Mr. Litzman. I spoke to him 3 times, and now the country is using these drugs.
Desde ese entonces, diferentes gobiernos lo han contactado, incluyendo el ministro de Salud del Estado de Israel, el señor Litzman, y ellos están siguiendo ahora el protocolo del Dr. Zelenko.
I think the president of Brazil is also interested.
También el presidente de Brasil, el señor Jair Bolsonaro, también estaba interesado.
And just last week, the FDA approved these drugs.
La semana pasada, el Food and Drug Administration, la Administración de Drogas y Alimentos, aceptó el protocolo del Dr. Zelenko, aprobó las medicinas para tratar a pacientes con COVID.
And it's important to realize that these treatment costs $20.
Es importante recalcar que este tratamiento cuesta $20. Now, Dr. Zelenko, Dr. Sanchez said that in Honduras the treatment is $8.
Okay. These are very old and cheap medication, which means that it could be used for a lot of people, and it's affordable, and it's also given by mouth and not intravenous, not IV.
Como él dice que estos medicamentos pueden ser administrados vía oral y sin necesidad de vía intravenosa.
The most important thing is to treat this infection early and hard, and that prevents, in most cases, the need to go to the hospital and be on a respirator.
La más importante es tratar a los pacientes temprano y bien fuerte para evitar que el paciente sea hospitalizado y puesto en un respirador o ventilador.
And the side effects of these medications, compared to the benefit of treating high-risk patients, is very positive. In other words, it favors treating because the side effects are very small.
Y los efectos secundarios son muy pequeños versus los beneficios de un paciente de alto riesgo que pueden versus los pacientes de alto riesgo que pueden morir.
We have to remember this is war. It's not peacetime. And in war, we don't have time to spend half a year doing research. We need to figure out which weapons work the best. And it's important to use every tool that we have to prevent people from going to the hospital, because many countries don't have enough. Even in New York, we do not have enough respirators.
Él dice que hay que recordar que estos son tiempos de guerra y que no tenemos tiempo para investigar y que tenemos que prevenir para evitar que los pacientes, y que como sabemos que en New York hacía falta de ventiladores, teníamos falta de ventiladores. Esto es para tratar temprano y evitar que el paciente entre al hospital. Dr. Sanchez, you had a question about something.
What?
¿Usted tenía una pregunta acerca de algo?
So, if anyone has any questions, it would be my pleasure to answer them.
I can't hear you.
I don't.
¿Es necesario hacer un electrocardiograma antes de dar este tratamiento?
Is there a need for an EKG before administering the treatment?
Right. So if you have the time and the resources, for sure, the protocol is you do an EKG before, and then 2 days later you can check another EKG to see if there's any QT prolongation. However, I usually see 40 patients a day. Now I'm seeing 160 patients a day with my team, and we don't have the resources to do an EKG in everyone. It's battlefield medicine at this point.
Dice que en este momento eso es medicina en el campo de batalla y que él no tiene tiempo para hacer esto junto con sus colegas. Que él estaba viendo anteriormente 40 pacientes al día y ahora está viendo 160. Y que es preferible hacer el electrocardiograma en un inicio y 2 días más tarde repetirlo, porque para ver si hay una QT, una prolongación.
So, if you have the time and you have the resources, then the answer is yes, you should do an EKG. But and then 2 days later repeat it. I spoke to 3 specialists that are electrophysiologists. Those are heart doctors that specialize in the rhythm, electrical system of the heart. And they told me that the risk is around 1 in 1,000 to have a problem, but the benefit is potentially to save 100 people. So for every 1 person that unfortunately get hurt by the medication, 100 people could be saved.
Okay. Él ha hablado con colegas y personas especialistas acerca del riesgo y el riesgo es 1 de cada 1,000 pacientes, pero que al final ellos tienen que considerar que en realidad el riesgo puede ser 1%, o sea, 1 de cada 100 pacientes.
And let me tell you how it works. It's actually very beautiful.
I think he has a question right now. I'm sorry, we can't hear you, Dr. Sanchez.
Let me tell you how these medications work. The zinc stops the virus from growing. The problem is the zinc cannot get inside the cell very easily where the virus is. So all hydroxychloroquine does, it opens a door and lets the zinc go from outside to inside the cell. And when it's inside the cell, it could kill the virus.
Sí.
And the antibiotic prevents pneumonia.
Antibiotic. Él dice que cómo trabaja, la manera muy bella que esto trabaja, es que el sulfato de zinc no puede entrar dentro de la célula. Y lo que hace el hidroxicloroquina es que permite la entrada dentro de la célula para matar entonces al virus. Y la citromicina es para evitar una neumonía. Go ahead, doctor. Dr. Sanchez, go ahead.
Ya habíamos escuchado esta cuestión tenemos algunas dudas. Cuando decide administrar este protocolo...
No lo escuchamos muy bien.
Ok, a ver si me escuchan.
Sí, un poco mejor.
Entendemos que es el protocolo de 5 días, hidroxicloroquina, zinc y hidroxina. Y nuestra pregunta es, ¿espera a tener un PCR positivo o lo administra con simple sintomatología en los pacientes?
Okay. El doctor Sánchez pregunta, a question from Dr. Sánchez is, do you wait for for the PCR or for the test to be so positive, or you begin to treat upon the symptoms?
I treat right away because the tests, at least here, take a few days to get the results. However,
él trata al paciente inmediatamente, ya que el test para determinar si el paciente es COVID positivo o no demora varios días.
However, if the test comes back negative, I could stop the treatment.
Pero si aún así, él manda el examen, el test del COVID, del virus, y si es negativo, él para el tratamiento inmediatamente.
Okay, we got it.
You also had a question, Dr. Sanchez, question about the prophylactic protocol.
Yes, that's important. I'm experimenting with that. I don't have the same amount of data. I have around 20 patients that I prophylax, and all of them are, including myself, didn't get the infection. And what I do, I use lower dosing. I use hydroxychloroquine, 200 milligrams once a day for 5 days as a loading dose. And then I use it once a week, just like we use for malaria prophylaxis. And I use zinc together with it.
Okay,
translate, please. I'm sorry.
Okay, but let me check this by you, doctor. You use as a prophylactic, you're using hydroxychloroquine 200 milligrams once a day for 5 days, and after that, once a week, yes?
Yes, with zinc.
With zinc. And what is the dosage in the milligrams of zinc?
220 milligrams of zinc sulfate.
Zinc sulfate, okay.
The most important thing,
Once a day?
yeah, but the most important thing is to get 50 milligrams of elemental zinc. It doesn't matter which zinc it is, but it should be around 50 milligrams of elemental zinc. So in zinc sulfate, 23% of that is zinc. So 220 milligrams gives you 50 milligrams of zinc,
Okay.
elemental zinc.
Okay, you got that, doctor? We're going to summarize that. Dr. Sánchez, toda esta información se la voy a mandar en sumario, en una carta, ¿verdad? Y la voy a verificarla con el doctor, pero prácticamente le está diciendo que el protocolo preventivo para aquellas personas que están expuestas es 200 miligramos de hidroxicloroquina una vez al día por 5 días y después reducirla a hidroxicloroquina una vez a la semana, la misma dosis de 200 miligramos. Y es importante el sulfato de zinc, que es 220 miligramos, que es 23% del zinc elemental, pero que después de eso el zinc elemental es muy importante. Yo esto lo voy a correr por él y le voy a mandar el protocolo en cuanto a esto. Ahora, también es importante, le voy a mencionar que ustedes ahora mismo no tienen, en Honduras no tienen hidroxicloroquina.
So what I'll do, so not to get confused, if you like, I can forward to you written protocol.
We're working on it, doctor. Frank is working on that letter. And we already wrote part of this, but I'm gonna run it by you before we send it to the Honduran president, President Hernandez.
Okay.
I have one more question. They don't have, I don't know if I mentioned before, and doctor, you have another question, and also they don't have, Dr. Zelenko, Honduras doesn't have hydroxychloroquine.
Do they have chloroquine?
Yeah, we have chloroquine.
Okay, so you can use chloroquine 500 milligrams twice a day for 5 days. And for prophylaxis, use 500 milligrams once a day for 5 days, and then once a week.
Okay.
Once a day for 5 days, and then once a...
For treatment, you can use
For treatment, I use twice a day for 5 days, yes.
500 milligrams twice a day for 5 days.
Yes.
zinc too.
And the zinc, but not the CPAC. Él dice que
For what? For prophylaxis, I do not use the Z-Pack, no.
Exacto.
Only for treatment.
Correcto. He knows. We wrote this, Frank wrote this, and we will send it to them. Otra pregunta, Dr. Sánchez.
Well, thank you very much.
You're welcome, and God bless you. And if you have any questions, you can always reach me.
Thank you very much, Dr. Zelenko.
Thank you.
Bye-bye.
Bye.
I wish you well. Bye-bye.
Thank you, Dr. Zelenko. Thank you, Frank. Thank you, Dr. Sanchez. Thank you, everyone. My regards to everyone there.
Thank you. God bless everyone. Bye-bye.
Bye.
Bye.